Hello, I'm Dr. Beth Godey.
And I'm Dr. Martha Leatherman. I'm a geriatric specialist in psychiatry.
And I'm a neuropsychologist, and I specialize in aging.
We're experts in dementia care, and we're here to provide you some information and answer some questions that we hear very commonly about dementia and other issues in aging.
You know, a concept that's been around for a long time that people are talking a lot about now is aging in place. Mm-hmm. And not everybody means the same thing when they talk about aging in place, particularly when it pertains to one of the retirement communities that they call a continuum of care, meaning the independent living and then assisted living, and then there's also a nursing facility attached and perhaps some dementia care, all in the same community. And you have a great example of how aging in place can be interpreted in a number of ways.
Right, and you know, when I think of aging in place, I think I want to stay in my house. That's
right.
My place. I really don't want to go anywhere else. But people will go to, they're known as CCRCs, continuing care retirement communities, that have levels of care. They have an independent living, assisted living, nursing home, and sometimes even a hospice on site. And they are sold to people as you can age in place. And, you know, certainly the resident who moves into an independent living situation in one of these CCRCs has a very different idea of what aging in place means than perhaps their family has or than the community has. So, for example, a patient that I saw doing very well in the independent living part of this CCRC, except for the fact that she called the front desk sometimes 12 or 15 times a day for help with things like the remote control to her TV or her coffee pot, because she would get confused about how to use these things. She had some very mild dementia, and that's why she was not able to figure out how to use these implements. But the facility, the community, did not think that this was an appropriate thing for her to be doing, calling 12 or 15 times a day and getting angry if the front desk person couldn't immediately leave and help her.
Right, because the notion of that independent living is that you're able to stay in your apartment or your suite and you can be independent. And however, the person you're talking about calling the front desk, it's sort of like you feel like you're in a hotel.
Yeah.
Like they should send up a bellboy to help me with my remote control.
After all, I'm paying for it.
Yeah,
I'm paying for this.
Yeah, I should do this. But at some point, the facility, the community realizes, this person may need more help than we can provide in this setting. Let's move her into assisted living. And that's where the real issues start.
Right, and from the point of view of this resident, assisted living, the next step up in terms of level of care, is for those really sick old people.
Right.
And this lady, she says, I'm eating fine on my own, I'm able to dress myself, I get out, I socialize, I even help other people who are sick, so I don't need that help. So within that community, the residents see a very big difference between independent living and assisted living, and then between assisted living and nursing home, that we might not see.
That's true. And actually there can be big differences between the independent living and the assisted living. In many situations, the assisted living may be in a different building. Mm-hmm. And so the relationships that you may have developed in independent living, you might have to lose if you do go to the assisted living. So sometimes it can be a big jump from one section to another for a resident.
Well, if you think about it, if you're not driving, some of these places are very large geographically. To go back and have any meaningful interaction with the people that you used to live with is almost impossible.
Right.
So it's a big deal. But what do we do about it?
Well, one of the issues is that the communities don't often have a very clear policy about at what point will you need to move out of your apartment. So you buy into the place, or you go to the place thinking, well, it will be up to me when I move, or my family can help out, but actually I'm the resident and I should choose.
I have my rights.
That's right. And the facility, the community doesn't have a very clear policy on that. It's like, how many times do you have to call down to the front desk about your remote control before we move you? And that tends to put families in a bad situation because they're not certain. What do we do? How will we know when we're supposed to be moved? And the residents don't really want to go. They don't want to leave their apartment once they're there. So it gets to be a very tricky issue as far as at what point is the person supposed to move.
And honestly, these are not hospitals. They're also not exactly apartments. So you have different kind of contractual agreements and arrangements than you would with something that's clearly a healthcare facility or clearly an apartment living sort of situation. And you have to be sure from up front, but also it takes some careful negotiation. Sometimes people will actually hire caregivers to come in and be with somebody in independent living during the day for a certain number of hours a day. Right. Sometimes that can work as a stopgap measure. But you've got to ask the questions before you get into the situation, really.
That's exactly right. And you need to know what would happen to me or my loved one if they have to move to assisted living. Is it in a different building? Is it just down the hall in another section of the building? What level of care would need to be provided for us to justify the move there? You need to start talking very honestly and openly before you move into a place like that, so that you know what's ahead and how you want to live your life and how you want your loved one to live theirs. Are you going to have extra caregivers? Will it take an evaluation by a professional to show that you actually have dementia before you'll move? You need to have those open and honest discussions.
And what happens if you disagree with the community and flat say, I'm not moving? Can they evict you? What's
right? What are your
what
rights?
Are the consequences and what are your rights?
Exactly right. So these are difficult issues, but just be mindful before you move into a place or you consider a place for your loved one that offers this continuum of care that sounds very easy to move from one stage to the next. May not indeed be easy.
Prepare and ask questions.
For more answers to questions like these, our book, The Insider's Guide to Dementia Care, is available at Amazon.com.